I beg to move that this House do now adjourn.
The question is that this House do now adjourn. Danny Beales.
Thank you, Madam Deputy Speaker. I rise today to discuss services for adults with learning difficulties and disabilities in Hillingdon. Approximately 1.3 million people in England have a learning disability, including those with learning difficulties. This figure is even higher. Yet too often our services, education system, our NHS, workplaces, our society as a whole is not inclusive of their needs, with them often being an afterthought. I was motivated to bring about today's adjournment debate, having recently had the privilege of meeting many adults with learning disabilities and difficulties and their families in the borough of Hillingdon. They again expressed to me feeling like an afterthought, appalled by the Council's recent decision to close another vital service for adults, following many other services being closed, moved or cut in recent years. Before turning specifically to these important services lost or under threat, it is important to note that, of course, there are many good organisations working hard in challenging circumstances to still provide support. In terms of the NHS, the community team for people with learning disabilities provides specialist support for adults with learning disabilities in the community across primary and secondary care. These services, however, are largely around diagnosis and access to medical support, just one aspect of an adult's needs. Dash, a voluntary sector group, offers a range of sporting and recreational activities for people with a disability, all focused on encouraging people to socialise. But I know they too have struggled with decreasing funding in recent years. And RAGC, Hillingdon Autistic Care and Support, who provide the Autism Hub, advice and social activities for the adults in the London Borough of Hillingdon. A slashing of RAGC's budget in 2023 led to the closure of the popular tea rooms, a training cafe open to the public which offered training and work support to adults with autism, a sign, unfortunately, of more damaging cuts to come. Following those proposals, an e-petition saw 3,330 people calling for the Council not to withdraw funding for the tea rooms at that time. But despite this, the Council pressed ahead, claiming that 20 people benefited from training and support was not good value for money. A disappointing sign of things to come, with the Council knowing the price of everything but the value of nothing. More broadly, in the area of education, the Parkview Centre, part of the Orchard Hill College Group near Uxbridge, has a range of on-site vocational opportunities. The college does excellent work in challenging facilities that were not purpose-built. I had the privilege of meeting a number of their learners and staff recently, and they showed me firsthand what they have to offer our community and workplaces. As well as insisting I attend their next disco, they also gave me an overwhelming message that they loved their job coach, Holly, but unfortunately there was only one Holly in the whole of the college, and they wanted more work coaches, more placements, more internships and more job coach support. Yes, learning is vital and important, but they wanted it to lead somewhere in adult life. They wanted real workplace experience and ideally a full-time or part-time role. And the government's commitment to invest more than £1 billion into workplace support for those with disabilities is a welcome step forward in this regard, and I hope the Department for Health and the Department for Work and Pensions will work together to ensure this investment is also targeted for adults with learning difficulties to get the support they desperately need. Data suggests that the employment gap for people with a learning disability is still far too wide. And when looking at people accessing long-term social care, only 5% of people with a learning disability are in paid work, which is a shame on our society. Charities have previously called on the government to set a new ambitious target for reducing the disability employment gap, with strategic actions behind it. A previous Secretary of State for Work and Pensions said in March 2023 that he would set up a new disability employment goal, but progress has been slow, and I hope this is something the Department can work together with the DWP to progress. Such a gap is why supporting workplaces, centres for training and volunteering is so vital. Following the closure of the Hillingdon Tea Rooms, now another such facility is under threat. There is a strong community-led campaign to save the Rural Activities Garden Centre, a garden centre which provides employment opportunities, skills, lifelong relationships and a connection to our community for adults with learning difficulties across West London. The Conservative-led Hillingdon Council took the decision just last week to slash this vital service. I've been shocked and saddened to see how the voices of adults with learning difficulties and their families have been silenced in this discussion, with them not even allowed to speak or to question the decision at the Civic Centre. Well, now in this chamber, we can make sure their voices and their stories are heard. A number of them are here today with their families in the gallery. George is 28. He was separated from his parents at birth due to their inability to care for him at that time, and he spent years unable to eat without a feeding tube and has battled self-harm throughout his life. After decades of struggle and for specialist support, 4 years ago George found something precious, a community at the Rural Activities Garden Centre, where he feels valued and understood. And since the announcement, and as a result of the fear that this vital support system may be stripped away, George's challenges have become overwhelming again. Oliver has been attending the RAGC for 10 years with complex health needs. He is partially sighted, has severe learning difficulties and chronic kidney disease. More recently, he's also been suffering from PTSD. Oliver's battle with mental health impacted his ability to do day-to-day tasks and the usual activities that brought him joy. But there remained one comfort, the RAGC. And there is Doug, who I've had the pleasure to meet, an adult with learning disabilities impacting his ability to read, write and count, where the private sector was unable to provide support to Doug with his additional needs. It was the RAGC that saw past what Doug couldn't do and nurtured what he could. They watched him transform from a young, shy man into a confident 32-year-old with purpose. After the closure meeting, Doug asked a simple but heartbreaking question: where do the staff go and what happens to me and my mates? I was also told of Georgia's story. Before joining RAGC, she struggled with anxiety and undiagnosed autism, leaving her imprisoned in her own home. But the Garden Centre helped her to develop skills, build confidence, and she even went on to compete in a wreath-making competition. It was the service, now under threat, that transformed her from someone who couldn't leave the house to someone who could confidently serve customers. What a transformation. And now she fears the closure will reignite those same issues she's worked so hard to manage. The difficulties of day-to-day life are often felt more acutely by adults with learning difficulties. It's the sanctuary of places like the RAGC which provide that make it imperative we continue to fight for its survival. The Rural Activities Garden Centre makes employment opportunities and personal development and skills curation accessible for those who are often isolated. I've met so many people from right across the community who volunteered there, gained skills, even moved into permanent jobs as a result. Families felt their loved ones were cared for and safe and nurtured in this space, and it's given carers and families their own ability for respite and time to care for themselves too. I'm glad to give way to my uncle.
I'm grateful. I want to congratulate the Honourable Member for securing the debate. He will know that the Garden Centre also provides an essential service to my constituents as well. I've been visiting the place for either 20 or 30 years, I'm not clear overall, and it actually was commended by the former Conservative leader of Hillingdon Council, who called it the jewel in the crown. That's why it's come as such a shock that this Conservative administration is now willing, with some brutality, to close it. Does he agree with me that the Council should now, literally, even at this late stage, think again, consult us properly, including all those volunteers and parents, as well as the people who use the centre, to look at a wider range of options? This doesn't have to happen now. They just need to listen to us.
Thank you.
I'd like to thank my honourable friend, and I concur with him completely. We've both met those affected, their loved ones and families, can really hear and see the value, and unfortunately that value has not been considered in the rushed decision that the council has made, and I'll turn to the lack of consultation very soon, and I completely agree with him about that. It isn't too late, and I hope that, like him, the council thinks again. The Rural Activities Garden Centre is another on a long list of closures at the hands of the local council. Following years of financial mismanagement by the leadership, the modus operandi has become to cut through their crisis. But while the council's cabinet sees nothing more than a line on a spreadsheet, behind this move there are lives of adults with learning difficulties whose lives have been transformed by this service and who risk losing it all as a result of their decision. By their own admission, they view the decision of the closure through the lens of profit. Failure to turn a profit means inevitable closure to Hillingdon Council. This was the reason quoted at the recent decision-making meeting. But should social services have to make a profit to survive? It, to me, seems to defeat the objective of those social services. By that logic, one wonders what next will be cut by Hillingdon Council. What other social services, what other schools would they have their sights set to? This heartless approach to community services aside, Hillingdon Council's binary decision-making in relation to profit is economically flawed. These services aren't costs, they're investments in the future. The NAO, the National Audit Office, calculated that supporting someone with moderate learning disabilities in residential care costs £4.7 million over their lifetime. With proper community support, such as RAGC, that drops by £1 million. We save money while giving people the dignity, purpose and independence that they deserve. Perhaps the Council's inability to understand this basic economic principle of investment and returns shed some light on why they're currently about to go bankrupt and receiving damning reports from their own chief financial officers. But still, Hillingdon Council dismisses RAGC as merely a retail service. Well, tell George, tell Doug, tell Oliver, tell Georgia, tell that to the families who've watched their loved ones being transformed from isolation to independence that this is a retail service. I recognise there are similar stories across the country, unfortunately. Scattering services, breaking up communities, destroying what works for short-term savings that creates long-term costs, with our most vulnerable communities always first to feel the brunt. The Rural Activities Centre works. Its clients thrive, their families are supported, the evidence is overwhelming. But evidence means nothing without political will, and political will means nothing without adequate funding. We're not asking for the impossible, we're asking for the Council and this government to back choice and independence for adults with learning difficulties, for those with care packages, and to recognise that supported employment isn't a luxury to be cut when times are tough. It's a vital investment that pays dividends in human dignity and provides economic returns for national and local government. The Rural Activities Centre must be saved. Services like it across England must be protected. The people who depend on them deserve nothing less than our absolute commitment to their dignity, their potential and their right to belong. I appreciate the Minister giving up her time to be here today with so many pressing issues across the health and care system. And there are some specific issues I hope that they can take away for further consideration from today's debate. Firstly, I and local families would of course welcome them to Hillingdon in the future to meet with disabled adults and those with learning difficulties, to hear their experience of a fragmented system, of a council and NHS not working as well together as it could and should, which I hope will help transform broader thinking around social care taking place nationally. Secondly, the Women and Equalities Committee report in 2023 into equalities for people with learning difficulties outlined very clearly that people with a learning disability and the people that care for them are the real experts when it comes to their health and care needs. However, aside from the occasional opportunity to feed into consultations, far too often their voices are missing when it comes to decision making at both the local and national level. Their lived experience should be better reflected throughout efforts to reduce health inequalities and improve outcomes. And I hope the government can look at how it can embed co-production and meaningful engagement in decision making around care packages and services, and ensure that those with care packages and support are genuinely consulted and engaged around any service changes, with clearer guidance for providers and commissioners of services about carrying out consultations and full equalities impact assessments being conducted before services are changed. As to be frank, this has been woefully lacking in this case. Thirdly, the NHS 10-year plan launched yesterday included welcome announcements about supporting people with health budgets, giving people personal health plans, and a shift to prevention and community-based working for the NHS. And I would ask the Minister to address whether we can and should expect the same principles to lead work around adult social care support too. Fourthly, on enabling joint working, the Public Accounts Committee in 2017 into local support for people with a learning disability found that people with a learning disability who live in the community have patchy access to healthcare and limited opportunities to participate in the community, for example, by having a job. While the department has the policy lead for people with a learning disability and care plans, responsibility for their support spans right across government. We even found this to be the case when discussing which department should take the lead on today's debate. Clearly, responsibilities cross the Department for Health, the Department for Education, the Department for Work and Pensions, and the MHCLG. When writing the report, the committee recommended that government should set out on a cross-government strategy for improving access to healthcare and opportunities for adults with learning disabilities to participate in the community, including employment, as well as how it will measure the effectiveness of this strategy. And I hope this may be something we can return to in future, as clearly all these departments bear some oversight and responsibility for this important group of the population. And lastly, I hope the Minister will join me in thanking Oliver, Doug, George and Georgia, all the service users and their families for building this project from scratch many decades ago, planting the first trees, building the first planters, volunteering to keep it going in difficult times, creating this amazing, life-changing project, and now also for their campaign to fight for its survival. I do hope Hillingdon Council will think again on this matter, take its time to genuinely listen and get the decision right, working with the community. In the absence of this, I hope the government will prioritise adults with learning difficulties and services like these. We were elected a year ago today on a manifesto of change, investing in people, transforming life chances, providing everyone with opportunity. Madam Deputy Speaker, these are the things that the Rural Activities Garden Centre and so many other services in Hillingdon have done and can continue to do for countless people in the borough of Hillingdon. Thank you.
Minister Ashley Dalton.
Thank you, Madam Deputy Speaker, and I thank my honourable friend, the member for Uxbridge and South Ruislip, for securing this debate around services in the community for people with a learning difficulty in Hillingdon and for championing the rights of people with learning difficulties in his area. And I also welcome those in the gallery today that are here to demonstrate how important services for learning difficulties in Hillingdon are to them. And I'd like to join my honourable friend, particularly to pay tribute to Oliver, Doug, George and Georgia for all the work that they are doing in this area. I'm aware that my honourable friend has a keen interest in health and social care matters as a member of the Health and Social Care Select Committee. He will therefore be pleased to know that the Government has today published its response to the Health and Social Care Committee report, Adult Social Care Reform, the Cost of Inaction. I'm sorry to hear that Hillingdon Council has decided to close the Rural Activities Garden Centre, but as members know, decisions on local services are for councils to make since they are best placed to understand and meet the needs of their local populations. I shall.
I fully appreciate the point she's making, but I wonder if she could take advice from other colleagues in other departments, and it's on this very specific point. My honourable friend and I have been working with different groups, and we've sought to register under the legislation the Rural Activity Centre as a community asset, which would force the local authority to properly consult with us and engage with the wider community. They're going ahead with the decision to sell or close in advance of even considering whether this should be a community asset. I wonder if she could help us by taking advice from whatever department is possible to actually see whether or not there's anything that we can do as a government to ensure that Hillingdon abides by the legislation that was passed to protect community assets like this.
I thank my honourable friend for his intervention. I can assure him that I will make sure that that issue is raised with the relevant departments. I'm also going to talk a little bit more, Madam Deputy Speaker, about some of the expectations that we would place on local authorities in terms of shaping their care markets to meet the diverse needs of all local people, something that they are required to do under the Care Act 2014. And this government recognises the vital importance of co-production and working with people who draw on care and support. And to ensure local authorities are meeting these duties, the Care Quality Commission are assessing local adult social services and publishing a full report and overall performance rating for each local authority. Hillingdon have been rated as good in their recent assessment, but their report also includes feedback on areas where CQC concluded that Hillingdon could improve. It is great to be having this discussion today on the last day of Co-Production Week, an important annual awareness campaign to recognise the benefits of working in equal partnership with people using health and social care provision. Local councils should absolutely involve, engage and consult adults with learning difficulties on their care plans, as well as on wider decisions that affect their care and support and their lives in general. We're committed to encouraging genuine co-production between social care professionals, local authorities, policymakers and, crucially, people who draw on care and support to design a system that works better for everyone, one that is fair, inclusive and puts people first. The Government recognises that investment in local services in the community is vital, and that's why we've made available over £69 billion for local government this financial year, increasing core spending power by up to 6.8% in cash terms on last year. And for Hillingdon, this means a total of £266.3 million in their core spending power for this year, an increase of 6.2% on 24-25. We strongly encourage councils to apply elements of good market-shaping practice involving providers. The Honourable Member talked about how people with learning disabilities should be worked with across government. But actually that is all government, because we seek to serve the people, and that includes people with learning disabilities. Yesterday we published our 10-year plan, and I'm delighted that social care will, for some people, be a key part of the neighbourhood health services that we discussed. But adult social care system is in need of wider reform, and we've already begun this journey, including legislating for a fair pay agreement and the independent commission into social care. Over time, the Neighbourhood Health Service and the National Care Service will work hand in hand with each other to help people stay well and live independently. To conclude, I'd like to note my honourable friend's invitation to visit Hillingdon, and I will ensure that that invitation is extended to the relevant minister. I once again thank him for bringing this forward, this important debate, and every member who has contributed. I hope Hillingdon Council take notice of this debate.
The question is that this House do now adjourn. As many as are of that opinion say aye. Aye. The ayes have it. Order, order.